Today we are going to interview Carl Stock, our Regional Sales Director, about his experience in the healthcare marketplace, his take on our company, and his thoughts on the future of radiology and the teleradiology marketplace. Carl, you've had extensive experience in the healthcare industry and joined EagleEye in 2012. Tell me what brought you to EagleEye.
Well, Erlinda, basically I was impressed by management's focus on providing quality radiology care, as well as the steps they've taken recently to improve the staff support for our radiologists. I was also impressed with current management's decision to focus on what EagleEye has really proven to do best, and that's teleradiology services, as distinct from on-site services.
When talking to potential clients and current partners, what do you hear them telling you is the most important factor when evaluating a teleradiology provider?
Cost is the most commonly given answer. I'd say that turnaround times and subspecialty training are high on the list as well. And I think with the imaging community being such a target for reimbursement cuts, you can understand why radiology departments are looking for the most economical way to deliver their services. So with that in mind, EagleEye is focused on streamlining our own business solutions and centralizing the operational elements of our company so that we can continue to provide high-quality radiology services at rates that are consistent with our clients' financial objectives. But with that being said, I really think there's a lot at stake when choosing a telerad provider. You want to make sure you're partnering with a company that understands the importance of customer service relationships just like you do, and they behave as if they're invested in your company. Because at the end of the day, the telerad provider you choose to partner with, they're going to be an extension of your care.
How would you respond to the idea then that teleradiology is a commodity and that not all teleradiology providers are the same?
Let me preface my response by saying this. I've worked in the healthcare field for close to 20 years now, so my answer is based on personal experience. I don't think there are many people out there who wouldn't research and very carefully choose their orthopedic surgeon or their cardiologist if they were going to undergo a surgical procedure. And I'm very comfortable saying that most people would spend a lot of time when choosing an OB/GYN to deliver their baby. And while I understand that teleradiology isn't one of those hands-on specialties, there is definitely a difference in who is reading that exam. And there's a difference in the level of service provided to the emergency room physicians. And there is certainly a difference between the companies that make an effort to build a relationship with providers and make themselves part of that team, and the companies that are predatory in nature and are just looking for ways to unseat the in-house group. I think the facilities really want to work with a group that provides a seamless extension of the care provided by the in-house group through the day.
I would like to thank the EagleEye radiologist who read exams for us last night. We had a head-on collision accident involving 3 adults and 5 children. Multiple CT and XR exams were done on all the patients. The radiologist got immediate reads back to us, which helped in getting everyone examined and the critical patients sent out quickly with all images and reports. The referring physician also wanted to relay her thanks to EagleEye for their excellent service during a very chaotic few hours. All the ER providers were thankful that reports were received back quickly. I greatly appreciate EagleEye's excellent service, especially during critical emergent situations.
Well, in your role with EagleEye as the Regional Sales Director, you not only deal with potential clients and our current clients, you also deal extensively with our own radiologists. What would you say is probably the most important characteristic about our EagleEye radiologists that make them ideal teleradiologists?
Well, Linda, there are several characteristics that I've seen since I've been here that not only make these radiologists well-suited for teleradiology services, but in my view, an essential partner in the business of patient care. I believe that these characteristics are probably hardwired into these physicians because of their military training. These physicians are just hungry to work and they roll with changes. They adapt and they make the best of a situation despite things not always going as planned. And they consider themselves a member of your team and not captain of their own ship. They expect to have their teamwork as well as their technical competence assessed on a regular basis, and they communicate very, very well. They create a trusting environment with facilities and providers, and their focus is always on the patient and the quality of the interpretation. And Erlinda, I believe that these qualities are very, very important to any facility trying to be successful in a constantly changing medical environment that demands flexibility, teamwork, cost-effective quality care, and a partner that is not resistant to change.
Well, we all know that a great deal of attention is given to turnaround times, price, the quality of reports, physician education and training. But what about customer service? Tell us a little bit about EagleEye, what makes EagleEye so special in terms of its customer service to clients.
Well, we believe that starts with communication, both here internally and with our clients. Depending on who you ask, you may find that the components of great customer service differ from client to client. So if you assume everyone prioritizes things the same way, you risk not meeting a client's needs simply because you didn't find out what's important to each individual client. We focus on listening to our clients, so we know what's important to each one of them. Customer service is one of those things that's a moving target, so we foster a relationship with our clients that encourages communication and feedback, so we know we're meeting their expectations.
From the beginning, EagleEye's goal was to remain a smaller company, not just in size, but also in geographic service area. What advantages do you think, as a business model, makes EagleEye more successful in this way?
I think we all understand that there are facilities out there that are going to require the services only a very large company can provide, simply because of the volume they deal with. But there's little question in my mind that there are advantages to working with a smaller company that provides services in a focused geographical area. And while today's technology allows for patient information and images to be transmitted all over the world, we believe that the actual business of it should be handled face-to-face whenever possible. And certainly business involving patient care, that should be handled face-to-face way more often than it is. And we believe that some of the advantages to this business model are a closer, more personal customer service relationship. We can meet with our customers more frequently and develop that close relationship. Any complaints or issues can be handled more quickly and on a more personal level. And we have fewer layers of management. So that means decision times are quicker, allowing for adaptability and flexibility. And we can just meet with our clients more frequently and learn their business. And we believe that's very important, and we believe that equates to a better customer service experience.
I understand EagleEye has invested a lot of resources in its data infrastructure. Could you please explain a little bit how that's a wonderful benefit for our clients as well as for data security?
Well, Linda, we're very fortunate in that respect. Our headquarters and our data infrastructure are located in what they call a commercial Tier 3 data center in Reston, Virginia. It's a secure 24/7 facility, and it boasts a 99.999% uptime. Our connectivity to the outside world is sustained by connections to multiple internet service providers, as well as multiple independent power grids. So basically what that means to our clients is their data is very, very secure, and our connectivity to them, as well as the outside world, is virtually bulletproof.
Thank you for your time today. For more information about how EagleEye can service your patients at your facility, please visit www.eerad.com.